One thing I want to mention in these videos is I have a third neurologist, and I think that he is working on listening to the patient and he's doing further testing. And I am still on the triliptal that gave me 80% in improvement when not being triggered, not having the neurological disorder triggered by stimulus like cold, flashing lights, weird and loud, obnoxious noises, like think of nails on a chalkboard. So I think that this gentleman, he sounds Indian, um, and he sounds older, so he does sound knowledgeable, and he seems to be working with me as a doctor should be. The doctor before him was inexperienced and seemed like a dropout. Not the doctor himself, like the doctor. So I had an older doctor that was very experienced that I had to ask to come up from Boston to the area I live in so that I could see him. And it was going great. And then I gave this phone number of my doctor's office and I gave my doctor's name to my father and his wife. And all of a sudden, hell broke loose once again. Whenever I get them involved, whenever I give their phone number out or give them the name of somebody, all hell breaks loose the month after. Anyway, so he drops out. He won't give me any answers. They say he's retired, but yet he's not retired. He still has a practice. He's still running a practice. Then I find out that there's another reason why he really didn't retire. Where did I hear that from? I said I heard it from the neurology office I go to. They said, well, you should have asked our office, but they still don't give me a straight answer. But he's still practicing, but he can't make it up here. So they said I'm going to need to find a neurologist up here. So I asked for a neurologist, and they give me a 36-year-old who doesn't seem experienced enough to understand my case. He seems very confused when I try to describe this to him. He understands it by the end, but he needs further information. The testing doesn't seem to be that great, but then he goes to drop the case right away after looking and speaking to my family as well. But then I get another neurologist, and after they look at the case, he understands it because he talks to the further doctor, Dr. Hodge, who originally believed in the case and was fine with it, and he still was fine with it. He only dropped it because my parents got involved. They're calling it a fantasy, they're calling it a mental illness, and saying that they're going to get attorneys involved. And they're trying so hard to make sure that these doctors do not implicate anything, that I had anything wrong with me during childhood, even though it's very obvious I did. It's obvious to anybody. I mean, my father, it's very obvious. I fell down in front of my father during a fireworks show to the ground, screaming in pain. I lost my eyesight and complete motor functions of my tongue and my complete nervous system after my mother administered me medication. When I woke up, I lost all motor function and I could not move my body properly. I was found sucking on my skin, trying to feel what was wrong with my skin, and at that time I did not have the words nerves in the skin. When I move my thumb, my leg bounces. When I try to talk, my leg bounces. When I try to move my tongue, my legs bounce. When I sometimes try to talk, my back spasms. Sometimes when I try to sit completely still, my whole body spasms. This has been going on since I had an overdose at about the age of 5 to 7 from my mother administering medications and adding something in. We know this because my mother repeated this behavior over and over afterwards. And she admitted to doing so, as well as she admitted in the doctor's office when I brought this up that there were medications administered. There was a reaction, and that she calls it an allergy to a combination of medications, But then she says she doesn't want to talk about it. She doesn't remember the medications. I'm still on those medications. She did not bring me to the emergency room. She doesn't want to talk about it further in front of the doctor. My father goes along with this behavior. It gets dropped. I still have problems moving my body. The teachers are concerned. This physical therapy, this speech therapy, my mother is told that they should do something. So my mother puts me in ballet. So we've known all about this. We've known all about these problems.